A 4-year-old kid is receiving treatment after being born with moles on his skin. Dylan Little has breast implants placed on his body in order to assist him to rid himself of imperfections. Moles cover 80% of his body, with one that spans the length of his back. A 4-year-old kid has undergone breast implants to save his life because his mother is concerned that the moles covering nearly all of his body would develop into cancer. Approximately 1 in every 20,000 newborns is born with a huge congenital melanocytic nevus, which Dylan Little of Atlantic, Georgia, was born with. When he was born, most of his body was covered in moles. The most prominent was a big one that stretched from above his ear to the bottom of his feet, while the rest ranged in size from a dot to a $50. Fears that the moles could develop into a lethal malignancy rose, and his parents, Kara, 38, and Nikki, 33, and they enrolled their son in a surgery to have the imperfections surgically removed. To do this, expanders are implanted under the skin, filled with saline, much like the method used in breast implant surgery, to stretch out the skin. Once the expanders have been removed, the expanded skin can be used to cover the places where the nevus has been removed. This procedure takes around 3 months. A total of 26 procedures have been performed on the very brave 4-year-old, with the result that more than half of the afflicted portions have been surgically removed. Kara, an air traffic controller, said that her infant boy's body had moles covering around 80% of its surface area. According to her, his back was completely black and bleeding, and his face, arms, and legs were completely covered in moles. It wrapped over his shoulders, tummy, and entire backside, and it was the largest of the bunch. There were also hundreds of satellites with moles ranging in size from half the size of $1 to the size of a dot on a pen. Our goal is that the moles will never activate and become cancerous, but he could acquire cancer at any moment in the future, says the doctor. Every 3 to 6 months, depending on the section of the body being operated on. For example, if the surgery is on the lower back, we wait 6 months before having another surgery to work on other parts. They employ procedural skin expanders, same as those used for breast implants. They place them within the body under the clearer areas and, over the course of 3 months, fill them with saline till they expand and triple in size, similar to a water balloon inside of them. After that, they'll use the surplus skin to cover the region where the nevus has been removed. The delicate areas around the neck, shoulders, upper back have been targeted with a 50% reduction, explains the surgeon. He may ultimately run out of healthy skin, but as long as we remove the vast majority of the greatest region, the likelihood that it will become malignant is reduced. We're attempting to do what's best for him. We want to provide him with the most fulfilling and longest life possible. Continually amazed by Dylan, his family has a smile on his face and acts as if he owns the hospital. All the staff are familiar with and adore him. His parents claim that they've experienced a great deal of difficulty as a result of unkind strangers who were unaware of his illness with him. Once he was being referred to as a monster. In order to address this, Dylan distributes informational cards explaining his illness, providing a link to a Facebook page dedicated to congenital melanocytic nevus. Once in a supermarket, the manager requested us to leave because one of their customers was furious over having seen our child, which was quite upsetting. Care explained the couple will not be hiding, and I will not be hesitant to take him out in public because I do not want him to be concerned or believe that he has done something to be ashamed of. Dylan also undergoes MRI scans twice a year to ensure that his moles have not turned into malignant growths in the areas of his brain and spine where he has a melanocyte deposits, in addition to operation to remove the nevus. We don't know what his future holds at this time. He might have days, weeks, years, or decades ahead of him, which is why we're doing everything we can to keep him with us. Kara explained the likelihood of a giant congenital melanocytic nevus developing malignant varies, with some estimates indicating a 5 to 10% chance, others indicating as little as 1 to 2% chance. The Sea of Nevus outreach Mark Beckwith stated that skin expanders are quite similar to breast implants in that they both increase the size of the skin. This procedure involves placing a device under the skin that can be grown larger as a result of stretching skin so that there's more of it to be available. Then they undertake a second surgery to remove the expander, which may include removing some or all of the nevus and replacing the area where the nevus used to be before it was removed with a newly expanded skin from the neighboring area. The Nevus Outreach International Registry has provided information that leads us to believe that the incidence of cancer is no more than 5%. may be as low as 1 to 2% in the general population. However, when the disease is identified in the brain and spine, as was the case with Dylan, the chance of death can be greatly increased. There is a comparable disorder known as neurocutaneous melanocytosis (NEM), which is characterized by the presence of pigment cells in the central nervous system. Continued lymphoma can be a significant condition and can even end in death in rare cases, because you can guess the brain is not the best place for a mole to reside. A large proportion of those who have this condition are fortunate, and that the moles in their brains do not interfere with their ability to think in ways that are very important. Every year, a tiny number of people, generally youngsters, are killed as a result of this. Neurocutaneous melanocytosis is a condition that affects the skin's pigmentation. NEM is a congenital condition characterized by melanocytic lesions of the skin. NEM affects children and adolescents. Melanoma in children who have NEM is a serious threat to their well-being. Congenital nevi are non-cancerous melanocytic lesions that usually occur in roughly 2% of all newborns at the time of birth. The term big, enormous congenital nevus refers to a solitary lesion that's more than 20 centimeters in diameter in adults, or a collection of lesser lesions that account for more than 2% of total body surface area. Because nevi are frequently coated with hair, the phrase hairy nevi is also used to describe them. Giant nevi are often bilateral in nature. However, they can develop anywhere on the human body. There are also satellite nevi present on a regular basis because of the distribution throughout the lumbar area and sacrum. The most common pattern is referred to be a bathing trunk or garment pattern. Neurocutaneous melanosis is a condition in which giant congenital nevi are seen in the leptomeninges of the brain in conjunction with melanosis. NEM is a disorder that is hypothesized to be caused by aberrant differentiation of neural crest cells, which results in an increase in the number of melanocytes in the leptomeninges, as well as cutaneous melanosis. In addition to other symptoms, it's important to note that metastatic melanoma is a different entity from neuroblastoma. Patients with NEM, on the other hand, are at a greater risk of developing melanoma. As a result, criteria have been created to help categorize NEM in order to identify metastatic melanoma from NEM with melanoma and metastatic melanoma that has not spread. Diagnostic criteria for neuromuscular disease, as amended by Catanoga and Freedom 1991, include the following: a congenital nevus of at least 20 centimeters or 3 or more smaller congenital nevi coupled with either melanoma or meningitis of the meninges is considered a malignancy. No cutaneous melanoma, with the exception of patches of meningeal lesions that were found to be benign. No melanoma on the meninges have been seen, with the exception of areas of cutaneous lesions that have been histologically proven to be benign. Apart from the skin manifestations, NEM might be asymptomatic, with the melanosis in the central nervous system scenes detected only on screening imaging. The disease's neurological signs are diverse and depend on the location and amount of melanosis in the central nervous system. However, the size and position of the nevi do not appear to be associated with the presence of scenes involvement, although this is still up for debate. Neurological signs are most common within the first year of life, with symptoms of elevated intracranial pressure, cryo, or hydrocephalus being the most usually observed. Seizures are another common symptom that presents itself. What other sickness or condition has some of these symptoms in common with this one? Because of the unique look of the nevus or nevi, the clinical diagnosis of nevi is usually uncomplicated. A biopsy of the skin can be used to confirm the diagnosis. If Sneen's lesions compatible with melanosis can be identified on magnetic resonance imaging, then the diagnosis of NEM can be made. If there's no evidence of metastatic melanoma in the patient's brain, aside from that, there are only a few skin lesions that seem like gigantic nevi. What factors contributed to the development of this disease at this time? Melanocyte migration abnormalities during embryological development cause which is a sporadic condition that affects the skin. Normally, melanocytes are found with the leptomeninges, which are generated from neuroectodermal tissue and are mostly found at the base of the brain and in the cervical spinal cord. Melanocytes are also found in the cerebellum and in the occipital bone. What triggers the aberrant proliferation of migration of the blonde acidic tissues, on the other hand, is not known at this time. Thanks for reading.